This award would mean a lot to him, a whole lot. He cared about his patients and he was able to give them hope. He focused on helping AUD patients because of his own experience that he kind of stumbled onto. He had story after story of patients who did so much better in a short period of time following these new, more modern and scientifically based approaches for treatment.
There was a moment where, as a team, we had received some evaluation data, and that data was particularly remarkable as we had identified 200 patients who'd been through the program, and that was remarkable. And then what was also really beautiful to see is that over 50% had filled the prescription to help move on that journey towards managing their alcohol use disorder. That was the first real positive step forward that we had a bit of an aha moment that said, wow, this is cool.
In 2018, my common law partner became very sick with diabetic complications, and I started to self-medicate. Simply enough, it started out as maybe 4 drinks in an evening to unwind. It just progressively got worse, and then of course I was faced with withdrawal. At the time, I had an alcohol and drug counselor who just said, you know, if you're bad enough, you need to go to KGH. When I first went, I always found the nursing staff to be quite compassionate. I did find that, you know, the last few times I visited, it's been a lot different. There's a lot more compassion. More of the doctors seem to be getting it. So I think there's definitely been some improvements made and probably some ways to go yet. I think even in the community treating these types of things, there is still some stigma, and I think we need to get past that stigma.
Ultimately, most proud of the team, most proud of the energy and enthusiasm and wisdom that came together across the health authority to really pull together an initiative that is not only being effective, but as we continue to monitor the data and the sustainability piece, it continues to change culture and continues to bring in numerous patients with AUD to supportive care and to effective medications to help them manage their conditions.
Receiving this award for interior health is really acknowledgement, I think, of not just the work that he did and really the foundation that he laid, let's say, but all the hard work that everyone else did. And so to just step back and say, hey, you did a great job. And I'm quite sure he would just say, go bigger, go big, create hope for people, and use science to treat them.